Turns out what I thought was a runny nose for the past decade from allergies is actually my brain leaking fluid. I don't even know where to start with this one, you guys. So I went to the ENT yesterday and I had a sinus CT done. I made a video about it, but it didn't get much engagement. But in that, I learned I do have a deviated septum up here. I have very swollen turbinates, as well as having fluid showing up in my sinuses just right here and everywhere else being clear. And when that showed up on the sinus CT that my ENT was showing me, she paused and she was like, this is kind of weird. I've never seen it where it's just here and nowhere else. I'm going to contact radiology for a second opinion because I want to figure out what this is because it is strange. And if it's something serious, I'll call you back before the end of this week. If you don't hear from me, it's fine. Don't worry about it. Well, I get a call this morning. So not even that long after, I get a call saying, you need to contact your neurologist as soon as possible because with your profile of having a potential connective tissue disorder and migraines, it's likely that you have something called idiopathic intracranial hypertension. And I was like, oh, okay, what's that? And she's like, well, it means that we don't know why, but for some reason, your brain is either overproducing or not absorbing enough of the cerebral spinal fluid that surrounds your brain. And it's to the point where it's so much that it's causing excess pressure building up in your head that it's draining into your sinus right there, which likely means that because you haven't really seen much improvement from using the steroid sprays as well as the Zyrtec essentially spray and taking Zyrtec every day for the past decade and having to use allergy eye drops, that nasal drainage that you've had constantly that's clear is not just from allergies, but also probably cerebral spinal fluid leaking out of your face. I'm sorry, what? She then proceeds to ask me, have I had tinnitus recently? And I was like, I don't remember a time where I haven't had tinnitus, but I just thought that was like common with autistic people because we're more sensitive to stuff that like, I just thought I was hearing the electricity because sometimes I do hear the electricity. And she was like, yeah, no, that's a sign of increased pressure. Also, have you had a significant amount of neck pain and pain in the back of your head? And I was like, yeah, that's literally why I started getting Botox and went back to a neurologist again because I was having such bad pain right here. And then she asked me if I have blind spots in my vision. And I was like, well, when I have migraines, I always get an aura. And she's like, no, not during a migraine necessarily. Although this, if you have this, it's going to cause more migraines. But like, do you have times where your vision just goes out of focus or it's like kind of blurry? And I was like, yeah, doesn't everybody have to sometimes consciously force their brain to focus their eyeballs on things? She was like, no, that's not normal. You need to also go to the eye doctor as soon as possible and have them check you with dilation to ensure that you don't have swollen blood vessels behind your eye. Because if that's the case and this isn't treated, the pressure will continue to build on your eyes and eventually it will make you go blind. What? She also asked me, have you had an MRI recently? And I was like one for my brain. And she's like, yeah, like a neuro MRI. And I was like, I actually don't think I have. I'm pretty sure the last time I had one was when I started having migraines when I was a child and they wanted to make sure I didn't have a brain tumor. And I went back and looked at my chart. The last time I had a migraine or a MRI for my brain was as a teenager. So this hasn't been checked for a long time. And teenager, I mean like young teenager, like 14 years old. So then she said, when I contact my neurologist, I also need to ask for an MRI as soon as possible. And fortunately, since they're both like in the same hospital network, my neurologist is going to be able to see the sinus CT for herself so that she understands the urgency. So at this point, I'm freaking out naturally. And I'm asking the NT, like, do I need to go to the ER? Like, I just Googled this while we're on the phone and it tells me that I'm at high risk for seizure, stroke, and unaliving. She's like, if you go to the ER, they're really not going to be able to do much for you because the treatment is surgery with a neurologist and they do a spinal tap and drain excess spinal fluid out of your head. And oftentimes ERs just don't have the ability to do that. And so they just send you home and give you a neurologist referral, which you already have, so you don't need that. I'm sorry, what? So you're telling me that this condition that I've just been walking around with for probably at least a decade now could have unalived me pretty much at any moment. And I can't go to the ER for any sort of help. I just got to wait now for more months until I get these tests run and then schedule a procedure. Okay, whatever. I'll just do all the things that you said I need to do. So I contact my neurologist. I tell her all these things. I'm waiting to hear back. I scheduled an eye appointment for this weekend so that I can get my eyes dilated and that my spouse can drive me because I can't drive when my eyes are dilated because I'm too sensitive to the light. And also light sensitivity, which I'm very sensitive to, is another sign of intracranial hypertension. But again, I just wrote it off as being autistic. So then I started doing more research on this because she explained to me that the idiopathic part means that they don't know why that this is happening. And as she's saying this, I'm like, I would bet so much money that this is another Ehlers-Danlos syndrome thing. So then you Google it and you find this on the Ehlers-Danlos Society website. Although it is not formally recognized, there are reports that have found an association between EDS and idiopathic intracranial hypertension. Good. Great. Love that for me. So then I started researching some more because I wanted to understand why does this happen when it's not idiopathic. And you find a lot of information about how usually intracranial hypertension is caused by head injuries that result in TBIs. And then you remember you've heard something recently about how emotional trauma, especially complex PTSD, is being considered something that now causes actual physical TBIs. So then you do a little bit of Googling and you find an entire research article about emotional traumatic brain injuries, about how there's evidence to suggest that PTSD causes issues in development of your frontal lobe as well as other areas of your brain, chronic inflammation that leads to, well, you guessed it, a TBI. And what usually is the cause oftentimes of intracranial pressure, increased intracranial pressure or intracranial hypertension? TBIs. So, meaning likely having Ehlers-Danlos syndrome, plus having significant abuse in my childhood and in adulthood caused this. Fuck you, parents. This is just... And if this is not the validation that I needed to just stay in no contact with my parents, because literally the stress from relationships with them caused me so much brain damage that my nose is now leaking out cerebral spinal fluid. I can't. To anybody who thinks that trauma is just something in your brain that you need to get over, if you just will your way through it, you'll be fine. My physical body is evidence that that is just not the case.